The gut or the brain? My name is Dr. Jin Sung, where clinical excellence meets excellent results. And today we have a case study for you. Is it a gut problem or is it a brain problem? So let's get right into the study. So we have a 19-year-old female college student who presents with acute GI pain and diarrhea post-meal. So whenever she eats certain things, she feels like she needs to go to the bathroom. Urgency impacting studies and social life. Basically, she's afraid to go out. She's afraid to take exams because if she eats, she knows she has to run to the bathroom. Okay? She also experiences inward trembling, like she feels like a tremble inside, not a physical trembling, but inwardly. Her heart rate variation, and she also has morning nausea. So heart rate meaning she feels like her heart rate goes up and down depending on what she's doing. And then morning nausea. She gets up, she feels sick, she feels like she wants to throw up, or sometimes she will throw up. If she has a sip of beer, it causes diarrhea, and also she also mentions vomiting. Okay. She did cheer in high school all through kind of like her early years, and she had a fair share of injuries. But she also has a couple of concussions that was undiagnosed, meaning she got her bell rung, she was kind of confused, but she kind of went about her business. So there was definitely a concussion involved. She also experiences anxiety, energy of 5 out of 10. She often goes to bed like 2 in the morning and will get up at noon, right? Otherwise, she really can't function. So that means she can't fall asleep at night. And then if she doesn't get her 10 hours, it's very difficult for her to function. So she often takes her classes from 2 o'clock on in college, okay? We saw her in the office for the first visit. Her oxygen level was 96. Her perfusion index, meaning how much oxygen is actually getting into the tissue, was only 0.12. You definitely want that above 1, okay? Heart rate variability. So heart rate, when she is lying down on her back on the treatment table, is 70 beats per minute. When she sits up, it rises to 86. When she stands, it's 104. So you can see there's a over 30 beats per minute variation between lying down and standing. Okay. She also has what we call poor capillary refill. This is when you like squeeze the tip of the finger. It should go white, and then as soon as you let go, it should flush and become red. Okay, meaning it takes more than 3 seconds to fully flush back. So it goes from white, and then it takes 1, 2, 3, and then it starts to turn pink. It should be almost immediate, the capillary refill. She also has what we call terminal tremor in both hands. This is where you touch your nose and reach to touch another person's finger. You get this trembling of the finger. So they call it terminal tremor. She also had dilated pupils. Okay? So I'll explain what's going on in the next section over here. So based on our examination on the initial consult, we decided to run a GI map because she has a lot of GI issues. Okay? On the GI map or the stool test, we found H. pylori or Helicobacter pylori. She had low Akkermansia municipalia, which is a abundant probiotic in our gut. They also had an elevation of strep and staph elevation, which are dysbiotic bacteria. So she definitely has some imbalance of her gut flora, and she has an infection. She also had elevation of Candida or Candida albicans in her case. Okay? We also ran a comprehensive blood work to look at her overall function, and what we found was something unusual, right? We had high red blood cells, and we had low hemoglobin, low hematocrit, low MCV, and low MCH. Now, whenever we see low hemoglobin, the first thought is, oh, this person has iron deficiency anemia. In this case, she had normal ferritin and she had normal iron, yet her hemoglobin was low, hematocrit, MCV, and MCHC. These were all low with a high red blood cell count. This is a possible thalassemia minor, which is genetic, okay? Low vitamin D and high homocysteine. High homocysteine can be an indication of a B6, 9, and 12 deficiency, or maybe a genetic defect with the MTHFR gene, okay? So there's a lot going on over here, and this can actually explain why she had poor perfusion in her hand and poor oxygenation, okay? So working diagnosis was she had SIBO. Although we did not run a specific SIBO test for her, she also had a lot of bloating along with the diarrhea, which is indicative of SIBO. She obviously has an infection with H. pylori and Candida. She definitely also has food sensitivity, because if she's eating or drinking beer, which has gluten in it, she gets diarrhea and sometimes vomiting, okay? She also has dysautonomia, or in her case, it's POTS, postural orthostatic tachycardic syndrome, where her position impacts her heart rate, and is likely due to her concussions during cheer practice. She also has thalassemia. We're going to refer her for a hematology appointment just to make sure we have the diagnosis correct for her for thalassemia. This is a patient who has been to Children's Hospital and has seen multiple doctors prior to coming to our office. She's had endoscopies, she's had multiple tests, and they were all inconclusive when they had the results, okay? Now, what do we do for this patient? We know we have some issues with the GI tract, and we also have dysautonomia or POTS. Okay? What we decided to do is a gut healing protocol to eradicate some of the infections. So we did a gut healing protocol with like diglyceride licorice, glutamine, marshmallow root, etc. We also gave her Saccharomyces boulardii along with Akkermansia municipalia. We gave her digestive enzymes along with HCl, a B complex to address some of the B issues, and a vitamin D and K complex. 2 weeks after that, we added in what we call a biofilm buster. So to kind of peel away the biofilm that's surrounding the infection, and then we gave her some herbal remedies to get rid of the infections. We also gave her breathing exercises, as well as what we call recumbent bike exercises. So she's able to sit down and pedal her legs to get her heart rate up a little bit, but not overstressing her symptoms. She may need additional care for her dysautonomia. So if she was near our office, we would have her come in, we might do some exercises with her. In her case, she lives near here, but she's often in school in New York City. So after 1 month of implementing this plan, she was 60 to 70% better in terms of how she reacted to foods and her bowel movements, okay? Another month after that, she was 75 to 80% better. She still had remaining heart rate variability, meaning her heart rate would go up and down depending on what she was doing. So we decided to refer her to a functional neurologist in New York City. A functional neurologist is someone who's trained to look at the neurological system a little bit differently and look at the function of each specific symptom and then target specific exercises that help balance the system. So functional neurology, you can find practitioners through the Carrick Institute, or there's another program run by Dr. Karazian and Dr. Brandon Brock called the Functional Neurology Institute. So there are different programs out there, and you want someone who's certified through that program to get functional neurology exercise programs developed specifically for you. So her outcome, despite having all these symptoms for many years, was very, very good within 2 months of implementing the program. She had some residual issues, therefore we referred her to a functional neurologist to get additional exercise programs for the brain. So the question was, is it the gut or is it the brain? In this case, it's both. If we don't address the brain or lingering brain issues, her GI symptoms will come back. So we want to make sure that we address the gut function, and then we want to make sure the functional neurology or the neurology component is addressed for this patient so she can live kind of a full life without depending on excessive sleep or running to the bathroom and going to doctor after doctor. We want to make sure her life is coming together and all these symptoms that she's experiencing has been managed, as well as the brain and the gut. All right, my name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.